Hello everyone from Amina Hospital, part of Amina Healthcare Group. Today we have Dr. Muhammad Abu Zaid, specialist pediatrician with experience more than 13 years, talking about immunization. We would like to point our followers that if you have any questions about immunization, you can ask through this live talk or through social media channels or by calling 800-26-462. Hello, doctor. How are you?
Fine, doing well. How are you?
I'm good, doctor. So let's start with the first question. Doctor, what are the vaccines?
Okay. Vaccine actually can prevent a certain serious and deadly disease. They are a way of teaching your body and your immune system how to fight the germs to a certain infection. Vaccine usually come in shots, but some vaccine come in different forms like nasal spray, like oral doses. So it differs.
Doctor, how do the vaccines work?
Okay, there are different types of vaccine, like live attenuated vaccine, like killed vaccine, but they all work as teaching your body and your immune system how to produce antibodies against certain germs. It's like to prepare your immune system to fight off germs. If you got in contact with these germs in the future again and this infection, it will help your body and your immune system to overcome this infection. Vaccines also, usually there's some vaccines come in one dose, some other vaccine come in 2 or more doses, and you need to take the full doses to be fully protected. Usually your immune system takes a couple of weeks to produce the antibodies and to make you fully protected against these certain infections.
Why should the child get vaccinated?
Okay. Vaccines are the most important thing that we can do to protect ourselves and our children against a certain serious and deadly disease. Vaccine can save up to 3 million deaths per year worldwide. And since we introduced the vaccine, diseases like smallpox, tetanus, polio, that used to kill the people or disable them, either gone or seen very rarely. But if the people stop having the vaccines, the chance of this disease to come back again very high. So we have to encourage all the people to continue the same practice and to continue to have the vaccines to protect themselves and their loved ones.
Are the vaccines safe?
Oh, yes. This is one of the most common questions that usually I get in the clinic. And the answer, yes, definitely yes. Before vaccines is approved to use, it has to go through a process. And this process is strictly under supervisions of doctors, experts that do not work in the drug companies that made the vaccine. These doctors and experts has to revise all the data, all the clinical trials, all the research about the vaccine to make sure the vaccine is safe before using to the public. And yes, it is safe. You know, unfortunately, there's a lot of misunderstanding and there's a lot of false information about the vaccines. And as healthcare practitioners and doctors, we have to face this. We have to try to correct these false information about the vaccine. One of the most common false information about the vaccine, the question of the parent that I have a concern about the vaccine and the autism. And my answer is definitely there is no any link between the vaccines and the autism. All the recent research and studies prove that there is no relation between the autism and the vaccine. So please don't be panic, don't worry. There is no relation between the vaccine and the autism. Also, one of the most common false information about the vaccine that if the vaccine contains any toxic ingredients, and the answer again, definitely not. Some vaccine contain aluminum, But the aluminum dose in the vaccines very, very tiny that cannot do any harm for your baby. So don't worry, vaccine definitely very safe.
Thank you, doctor. Do the vaccines cause any side effects?
Okay, generally speaking, vaccine again are very, very, very safe. So, but sometimes, yes, they do. But most of the side effects that we can see usually, it's like the low-grade fever, bony aches, flu-like symptom, swelling, rash. And this is a good news that your immune system is responding to the vaccines. It's not about you are sick, no. The good news that your immune system is responding. Sometimes there is very uncommon and rare more serious side effect like allergy to vaccines. But don't worry, it's very, very rare to see this.
Thank you, doctor. We would like to mention to our followers who have joined now, we have Dr. Muhammad Abu Zaid, specialist pediatrician with more than 13 years of experience. We talked about the immunization. So if you have any question, you can ask through this live talk or ask by social media channels or by calling the call center 800-26-462. So let's continue. Doctor, what will happen if there is a missing dose?
Okay, it happens, unfortunately. But again, our recommendation and our advice for all the parents, please stick to that schedule and please try not to miss any dose. But also, don't worry, if ever this happens, your practitioner, your doctor will reschedule this missed dose. You need to start the full doses over. It's only we can schedule this missed dose.
If the child was not vaccinated, can we start catch-up vaccine?
Okay. Actually, vaccine, we should start the vaccine in early infancy. But for some reason, sometimes the parents haven't started the vaccine yet for their kids. But again, don't worry, it's never too late. We can do something called catch-up vaccine. Then we can reschedule all the vaccines from the beginning, and your baby can go very normally with the vaccination schedule. And yes, we can do this catch-up immunization, and it will depend at that time the age of the baby, any other vaccine he has received before or not. But still, it's never too late. Yes, we can do it. We can do catch-up immunization. So don't hesitate. If you didn't start, please start from today.
Are there any vaccines for travelers?
Yeah. Actually, if you plan to travel abroad or internationally, yes, maybe your children need special vaccine and additional vaccines because different countries have different health risks and different diseases. So like if you're traveling to tropical and subtropical areas, you have to get yellow fever vaccines. Yes, traveling abroad internationally, you can come and ask your doctors and he will advise which vaccine suitable for your children and your kids.
So the last question, doctor. Can the child be vaccinated in case of sickness?
Oh my God. This is one of the most common question I get in my clinic daily. And the answer, yes. If your child have only mild symptoms like mild fever, body aches, flu-like symptoms, no need to postpone the vaccination dose. You can still give your baby the vaccination dose. Don't postpone it. Just few cases, if your baby have severe illness, at that time we can consider to postpone it. And there's also some few cases like in immune deficiency cases, severe immune deficiency cases, at that time maybe we'll advise not to give certain types of the vaccine because of this case. But generally, again, yes, if your baby have mild symptoms, yes, still you can give the vaccine.
Doctor, do you have any advice that you want to give it to the patients?
Yeah, definitely. Just the home message that I want to give to all the parents. Please protect your child, protect your loved ones, and give them the vaccine immediately. Vaccines are safe, vaccines are effective, vaccine saving lives. So please don't hesitate and start now.
Thank you, doctor. At the end of our episode today, we would like to thank our followers and Dr. Muhammad Abu Zaid for the valuable information. If you have any question for Dr. Muhammad Abu Zaid, you can ask through the social media channels or by calling 800-26462. Thank you so much, Doctor.
Thank you so much. Thank you.
Thank you.